let us get above all of that. There are two ways to doing that. The humanitarian impulse that comes from healthcare, and the humanitarian impulse that's embodied in missionary. How can we structure this to get away from that kind of simplicity? So of all those arbitrary distinctions, we would point out that there are some that are brutally common to all people. Morbidity and mortality. I make those definitions for medical students. Mortality is the loss of years from life. But probably more tragic is morbidity, the loss of life from those years. How can we reduce those? And how can we find out a way to save lives, both in the sense of reducing mortality and in trying to enhance those lives that are saved? Reduction of morbidity. And I point out that on the planet, we have about 4 reasons for the immediate loss of life. Now, immediately when I ask my students, what are the largest causes of death on the planet? Heart, cancer, stroke. Wait a minute. Those are diseases of 55-year-old white males. By definition, legislators, therefore, are funded. Not at all. You have to be wealthy to die of such a problem. The number 1 cause of death on planet Earth is diarrhea. How much research do you need to figure out what diarrhea is caused by? Acute respiratory infections, malaria, malnutrition, and measles. Can you believe it? This is what I call a day on the shame. Not a nickel's worth of research is required to learn what any of these is caused by. All of them are not only treatable, but most of them are quite preventable. Now I'm going to give a definition here for those that don't usually think in epidemiologic terms. The difference is that between infestation and infection. Don't worry, my medical students never figure this out. An infection is an organism that invades the body and starts to multiply. And you all know, much better than my medical students would, what a logarithmic growth rate is. And if I have one organism, like a pneumonia bacterium, and it becomes 2, then it becomes 4, then it becomes 16 and 64, then rapidly it can take over the host and cause its death. Suppose I have a drug or some other means of intervening that is so good that it reduces by 1/2 the infecting organisms. Now, it's of no purpose at all, because of the next doubling within hours, it'll be back at the same rate. So we try for a cure in infectious disease. An infestation is different. If in the soil there's an egg from a small worm, and I take in that egg, I can only develop 1 worm. That then can multiply and put out millions of eggs, and they go out in the environment and infest me. However, that's a public health problem. And therefore, if you have a way of reducing that burden of disease by killing half the worms, that means a child can learn. A woman who's pregnant can bear that child. A worker can actually put out enough energy to sustain a family. So disease burden, we talk of control, not cure. It is not my job to cure the world. However, what I am trying to do is find out means that they themselves can learn and to employ to control the burden of their disease. And how is it possible? Well, we have a number of those diseases that are quite neglected. So here are those causes of morbidity. They have fancy names. I love them because they sound more like poetry than they do. Planoarchus sinensis, Diphilobacterium bothum, Enterobius vermiculatum. These are worms. Very simple, very straightforward. And I just described it to you. An egg comes in. It's one creature. That creature can continue to produce. However, that burden is easily controlled. Schistosomiasis, another fancy word that simply means that anyone who has exposure to water there is going to be contaminated by this. The filariasis, all of those make it very difficult, though they do not kill the individual, typically at least assumed. They put a burden of high morbidity. So how can we leave people? I can assure you right now that those neglected tropical diseases that I just listed 5 are not medical. They are engineering. How can we structure the environment to remove exposure to such contaminants? And you know how to do that. I am constantly confronted with the fact that the large burden of disease I see is Watsan. You know that, and I have less facility with it. So clean water and sanitation is one of the things that I'm constantly asking to bring with me some of you, along with my surgery residents, and along with my ID fellows and others. Because you're going to do it wholesale, we do it retail. No, that's fine. Everything I've talked about is far, far away. Lots of people have interest in doing this experience with me because it's exotic, it's remote, it's quite an adventure. Yeah, it is. But remember, I require, but don't furnish the motivation. So someone is coming and says, I want to go with you to these remote places and have this wonderful experience because I've never seen the Nile. I've never been up to the highest mountain peaks on earth. Go whitewater rafting. I'm not an adventure travel company. I happen to have more adventures than any of those. But if you're going to convince me, you're in Rutgers here. Look at Newark. If you're talking to me and I'm in Washington, D.C., I point from my window and I say, here's Clinica de Puebla. After you've gone there for a few months, come on back and you will understand. So when you say, I'm only going abroad because that's an exotic experience, it can't happen here. I was on the first aircraft. We had to put a runway in front of us with a bulldozer in Jefferson Parish, New Orleans, following Katrina. And I can assure you that there were not too many differences among the circumstances of the people I left from Eritrea to come to Louisiana. And the differences were only twofold. One, starvation was the phenomenon, and one, obesity was the phenomenon, the other, as for the malnutrition. But otherwise, they were indistinguishable in the problems. So the haves and the have-nots, a very brutal reduction in humanity, is a simplicity we must get above, and we can look to see how can we resolve some of those problems. And I'm going to give you this one because it happens to fit the metal of my strike zone. It may not be everyone's. Be aware that when you intervene with the skill that you have, that there are easy resolutions to problems. We look for that, we know, and therefore find it. Be always alert that there are unforeseen consequences that you may not know or don't want to, and therefore will never find. I give you this example. I'm an endocrine surgeon. I deal with the glands of the body. One of those glands is the thyroid. One of those regulators of metabolism. The thyroid is that which sort of sets your thermostat and has you in terms of your activity. It's a complex gland that organifies iodine and makes of it a modulant hormone. And it does a pretty good job. If you don't have enough of the iodine or if you have a problem making the complete organic molecule from it, as the adult you can get an enlargement of the thyroid called goiter. A bigger tragedy is that of the child who never develops. It's called cretinism. Now, I've got a hammer. I can fix this problem. It's simply a nail. I can take out that goiter. I can fix it. Yeah, I can. And I've done that 22,000 times. But I must stay alert as to what it is that I might do by that intervention. Here, for example, is a woman And here is not a child. That's her daughter. Her daughter happens to be 23 years of age. But as a Cretan, she is not developed. She looks like a child. One of the things you can see is that she hasn't lost her deciduous teeth. She has 2 rows of them. Another thing is that she's intently staring at me because she's deaf-mute. I have a hammer, remember? I can solve this. So what I do is I remove her goiter and I get iodized oil, meaning the depot reserve of the iodine. And she comes back without a goiter, and I created a fertility explosion. Now think of the consequences twofold. That by preventing cretinism and by fixing goiter, they don't recognize this as a cosmetic problem, but dolls have goiters. What I've done is created a demand for greater nutrition. Because these people are getting by very nicely on 800 calories a day. And by restoring a micronutrient without adding a single macronutrient, I created hunger. So by intervening and solving this problem, what I have done is create a new class of higher consumers in greater numbers. I have to explain this to a group as young as this, what the Vietnam War was all about. They used to say, why don't we just declare victory and leave? That's almost always what aid programs do. They go in there and say, look what a good job we've done, and then withdraw and never look to see the consequences. That might not be all good. So be aware continuously. For example, if you want to write down none of your strengths out, that a dam is a very attractive project to any engineer. It does wonderful things. It controls flooding. It gives recreational activity. It stabilizes a water supply, and it makes for power in terms of hydroelectric. But wait a minute, it also creates a huge reservoir of small snails. Those snails hold the schistosomiasis, and every new dam is another 500,000 cases of schistosomiasis. So we must mitigate anything that we think of as an advance. It comes in the middle of our strike zone that no one else might have that idea. I had a habit of listening to NPR, maybe in Rutgers and Geelhoed, and he defines this hybrid, the theoretic hybrid, like a Jehovah's Witness and a person who goes around from a Unitarian church, and they go together to ring the doorbell. He says they go from door to door ringing the doorbell for no particular purpose. That would be my idea of someone who went out as an engineer or as a physician or as anyone else who wanted to remake the world, but didn't understand that it's to the purpose not defined by the giver, but by those who are on the receiving end, and make them new givers. They may have a different set of criteria altogether than do you. Anyone who knows that I work in Africa worries about this disease. In fact, the medical anthropology of disease is largely not structured by the first world in that which causes those things. The biggest trade in African history, the biggest economic event, was the traffic in human beings. And that brought endemic diseases through areas where it spread. Those people, of course, were not aware that they were subject to this great experiment. I give you this environment where I worked before, during, and after the greatest of the Holocausts that happened in Africa. I said, this must be market day. And they said, that's your waiting room. They know that we're coming, and the insatiable demand for health care. I was followed by a National Geographic photographer who happened to take this picture. Oh, it's won him the award as the #1 documentary picture of the year. This is an 8-year-old girl who's bringing in small brother. And in the line outside the queue you just saw, she collapsed. So we brought her in, and I realized at this moment, she was lying unconscious. That's when she lost the pulse. So I had Juma come by, and I said, Juma, get this IV started, because I'm going to be busy for a few minutes. And I said, I'll back you up if you don't hit that. I will help you. So Juma tried, and Juma got the IV started. We gave this small 8-year-old 11 liters of fluid over the course of the next 8 hours, and she woke up and looked around, was very startled, said something we didn't understand, walked off, all alarmed because she picked up her baby brother and carried him out of the clinic. And I said, as I rushed over to the door, I wanted to yell as opposed to that. I want everyone to know that's Juma's save, not mine. Juma the Hutu has saved this Tutsi child. Again, I'm in an environment in which Chad has its own set of rules. A woman must have her head covered. If she doesn't have her head covered, she's a prostitute. And they understand those rules, and we might not from a distance. So let me show you 2 people who are saving lives. One you probably have an easy understanding of. But here's a woman, and she has got 3 children. One of them is a small boy on her back. One of them is a 5-year-old boy she's leading with her left hand, and the other is a daughter, 7, on her right hand. And there's a Janjaweed coming at her. She realizes, having been shot at, she did not realize that her son on her back was struck. And we had a hard time removing the body from her. However, instantly, she knew what was happening, and what she did is she tore her head cover off and wrapped it tightly around her 5-year-old boy's head, creating a little girl. And the Janjaweed just slashed at her with a saber, daughter of a prostitute, thereby saving her little boy's life, not the one on her back, but the 5-year-old. Yes, life-saving is going on each side, but this one is done with her own inner resources. Do you have the courage, do you have the ability to see such problems and as clearly as that? Yes, there are lots of things happening in the world. Jumping into the deep end of the pool is sometimes a hazard. It is a big hazard. Let me define that hazard for you. It's not that you're going to change cuisine. It's not that you're going to be exposed to disease. Not that you're crossing a language barrier. It's not that you're doing something in a different economics. The single thing is, I need folk outside their comfort zone. That's where I live. That's where learning is most intense. So the learning experience I call transformation. I am here in Mother Teresa Clinic in Addis Ababa, Ethiopia. With me is a fellow named Ray Coates, good friend of mine. We've been together a long time. The 2 things that I brought there were some experience. One of them, having gone up in the Ethiopian highlands, I bring back this goat herder who's carrying a goat over his shoulder and shortly develops this morning cellulitis. I come on in, and the next thing I hear is from Washington, D.C. I always know that someone calls me and says, my name is Anthony, and I'm from the government. What agency do you represent? This is a disease that you've all heard about from the newspaper, because they asked me the question, how can this be weaponized? Anthrax, of course, no one would have experience with it here, but there it is not an uncommon problem. This is the real world. I'm sitting here with a group of kids. You're not allowed to take pictures inside Mother Teresa Clinic, so I take them outside and we feed them all fruit juices. And here's a child who has Pott's disease, that's tuberculosis of the spine. Here's one who's got Hodgkin's disease, recurrent after a failed therapy, codes, and ET that fell from the planet. Here you have someone with a melanoma. Here you have a kid with again with one of those malignancies. Here's a guy who has this convalescent sarcoma. And that's the starting point. But give me the more interesting variety. This variety, with me, I have a GW medical student. Her father is an Egyptian cardiologist. Her mother is an Iranian gynecologist. She's Shia. Next to that is another one who comes from Thailand, where he was a Buddhist monk before he went to medical school. Next to that is a young lady who comes from Universidad del Chuay in Ecuador. And then me. And Rick, who's the American Jewish Distribution Foundation, and another who is an Islamic Indian from one of the provinces of India. And one of the Sisters of Mercy from Albania came in and said, "And who is he?" The reason everyone was laughing, Rick Hood said, "He's the captain of a Panamanian freighter," which is exactly what each of us represent. We are all here with a variety of backgrounds. I know so little about engineering that I'm going to be totally dependent upon you. You may not have as much medicine as do I, but it's not rocket science. We can share. And each of us have a major function in indigenizing that care. What can I do to work my way out of the job? What can I do to make sure that when I leave, I haven't elevated expectations and created a great deal of frustration when I'm gone? What can I do to not have these people follow me? No, I want them to supersede me. They must do better with what they have, and that's the single secret. We're here in Rutgers, we're here in America. We have redundancy in depth, a great NASA term that I like because it says exactly what it is. Redundancy in depth is a redundant term. There, they have to take care of bigger problems in larger numbers with fewer resources, and that's a lesson we have to learn from them, not the other way around. As a consequence, that which you will see and that which you will do going forth from here as EWB over those boundaries are to see as they do, and perhaps with the additional skills and the huge advantages that you have, having had an education that any one of them would give 20 years of their life for and have. There are fascinating things, of course. The middle one there is a crocodile bite. The Nile fisherman who was walking along with his spear, trying to spear the catfish, and was pulled down from behind. He was thrashing in the water, not knowing quite what happened. And by accident, that spear caught the crocodile into that tiny little walnut-sized brain. So I can tell you that it was 3.4 meters long when you found it. But the fact is, they had only called me to say, we'd like to have you come as quickly as possible because we're going to take the leg off at the hip. Well, now, wait a minute. Well, why not give it a try? So you see, we put in there laughter, we irrigated it, you see the brains and everything else like that. The fact of it is, that's a long shot. But I went back this next year, 6 months ago, to the Upper Nile in South Sudan. And this man led the dance at the reception. That's a miracle, not of my making. Perhaps the miracle is that I'm there, and that they are carrying on and doing it better. There are many things that I could refer to from areas of the world that are called failed states, or shall we say pre-failed states in the case of South Sudan. There are many of those folks who don't have the advantage of a structured environment. They can't gather a group this large. They don't have electricity. I spend an enormous amount of my time cleaning water for our own being. But wait a minute, that's 1/3 of the daily activities of a woman in Africa, is getting water, and it won't necessarily be clean. So there are many things that we can point out from these examples. These examples are as close as this one. I've had blessings from the Dalai Lama. I've had priests that have consecrated in clinics. This is the first time I've had a voodoo priestess. I said, would you do me a favor for the students? no sacrificing of the chickens just for their sake. But these are environments where your skill combined with the humanitarian impulse that brings you to an EWB conference means that you will be able to see through that complexity to a simplicity that may be beneficial, but always carry with you the idea that you must be careful in imposing a solution they might not choose. You have problems with starvation. You're having too many children. I know how to solve that. Put in a birth control. Wait a minute, that's my Social Security system. You have a problem. You have floods here part of the year, and it's dry the rest of the year. We'll build a big dam. Well, wait a minute. That's the only arable land here that you just flooded. Remember then that we approach each of these problems not as someone coming with a white horse and saying, what only politicians and physicians ever come up with an arrogant statement like this. I know what's best for you. Wait a minute, you don't even know me. How can you possibly know what's best for me? So listening is what we do a lot. Telling them what should be done is something I wait to hear from them. And it is possible, even when the barriers are broken down, here, right exactly where the typhoon had just gone through, are groups of people. I have a socially embarrassing problem when I get together with them, but they have a problem with endemic goiter. They don't need to have that operation if we can prevent it. So we go up into the highlands and we use the iodine that I just mentioned as a distribution thickening in depot form. And now that's the new team. They don't need someone from air filtering to come and pop up. Medicine in the world, I keep saying over and over again, is not a white man off an airplane. It's more often an indigenous woman who knows how it is to prevent this disease. Here is the place that you know about from the news. Can you imagine being a woman in obstructed labor? And they say, we have to take you somewhere where you can have that operation, and we take the child out. She gets in a taxi, which you see on the left. It goes through the surf. It comes to Puerto Princesa, the capital of the province. Puerto Princesa has a hospital. The physicians in the hospital know English and healthcare. 2 tickets of maternity that let them make a huge jump, make it a 50-fold increase in their income if they can find their way to the Middle East or to Nevada or to New Jersey. They then supply most of the remittances that constitutes 3/4 of the GDP of the Philippines. As a consequence, there's an acute healthcare shortage in the Philippines because it's exported, because they use English and they use healthcare as their ticket to the new world. So here's a woman coming across the surf in obstructed labor in that device and comes to the hospital where a young man I had just seen, 18 years old, has tetanus. Tetanus, do you know what tetanus is? There are 100 cases a year in the United States because it's so easily preventable with tetanus toxin. There are 100 cases an hour in Africa because immunization isn't universal. This fellow has tetanus, and I want to see how he does. So I start him on whatever I can. I have to do a hand ventilation because we don't have ventilators. Then we try to get him to the point where we can stabilize him. So when I heard about this woman who comes to the Puerto Princesa, capital of the province hospital, and the physician is left to go to a nursing home in Nevada, there is no doctor in a hospital with 250 patients. So after doing the C-section, I wanted them to see how this fellow was doing. And in fact, the nurses, they have to do what it is that can be done. They're functioning very, very much as physicians. There's no alternative. Well, we've got all this stuff. We will be able to control our environment. Here are the icons of American invincibility. Put another hurricane of the kind that went through the Philippines, through an environment such as Jefferson Parish. And immediately we are reduced to the same circumstances. So it is not just disease I'm using as my model. Look at the engineering that makes of all of us victims of our environment. And the only way we survive is not as individuals. Relationships are the key. And the relationships that I'd like to encourage you to think about is to build one with a partner. That partner is in the laboratory that you need as an access to how to solve problems. Now I give this to you because I told you that around the world there are lots of hardships and there are lots of things that are fairly arbitrary. And I'll tell you this because I come from Washington, D.C. There's a wall there, and on the wall in the museum is a sign that has two words: never again. I have not got that many years on me. And never again has happened 5 times over in my presence. In the Congo, in Rwanda, in Somalia, in Cambodia, and now in the CAR. Joseph Kony is my opposite mood. So, yes, we have been subject to a problem. I'm standing at 9/11 in Venezuela. Why are these people so upset with us? They're upset with us because we seem to have and seem to exploit a number of the world's resources. When in fact, what we need to do is to not redistribute the world's wealth, but to redistribute the world's knowledge and that ability to solve problems by themselves. EWB is an ideal organization for that. You're not going to be taking a C5A and dropping things from the sky. You're going to be going there and finding out how it is that those problems can be solved and what can be done for them. Some of these data are put into a book and made it available, and I can sign it for you all here. And another one is coming out next week. I've taken this to the high points. This happens to be things that I think is always fun for me to explain. Get your mind around this concept. An equatorial glacier. The highest point in South America, the highest point in Africa, are snow capped on the equator. 0, 0 latitude. And I'll end with this. What can be done with this? This is a woman who's so bizarre. She's brought up on it. Wait a minute. I said, hold it before we dismiss her and throw her away. That eye, so displaced, has what we call Count's fingers vision. Well, she's going to take too many resources. Well, bring her with us on the plane. We bring her down to Addis Ababa here. CT scan. It's a very big tumor. But wait, there's a clearance plane down there. You know, I think, wait, we might be able to do it. And one single stage resection, reconstruction, she has binocular conjugate gaze. Well, that's a miracle. We now have a miracle is that you're here and can be there and can not only do something like that, but teach other people how to do it. So we are never, ever going to be satisfied saying, we're doing something good, so we don't have to do it very well. This is not engineering light. This is without the colleagues, without all the materials, without the tools. You have to do something much bigger, much grander. Never be content by pushing something up 1%. The first day you arrive, you can improve 150%. minimal amount of information that you've come with. What you've come with is a solution kind of mentality. We are not content with the status quo and never, never be. Thank you for your attention.
Thank you, Dr. Geelhoed. And thank you to Lockheed Martin for sponsoring Dr. Geelhoed's talk. Can we give another round of applause for Dr. Geelhoed? Here is Brian, who is actually the webmaster for the Northeast region, and he's also an employee of Lockheed Martin, so he's going to make a comment.
Hey everyone, I'm Ryan Dedeker. Lockheed Martin would also say they really support what EWB-USA does. That's why they're sponsoring, and they hope that you have a really good conference.
All right, so now we're going to hear a few words from Kathy Leslie, the Executive Director of EWB-USA, and she'll tell us a little bit about how things are going.
Thanks, Cassie. First of all, let's give the Northeast region a round of applause. They've worked really hard for us to have a great conference. Good morning. Oh, come on. You guys can do louder than that. I got that in San Diego with half the people. So, good morning.
Good morning.
All right, one more time. Good morning. There you go. So, good morning. Good morning. There we go. So, my name is Kathy Leslie. I'm the Executive Director of Engineers Without Borders USA. And it's my privilege to have had that job both as a volunteer and as a paid staff person for about 10 years. So to start off, I want everybody to stand up. Stand up, stretch your legs a little bit, glance at your neighbors. Now, if you just joined EWB since September of this year, sit down. Okay. So that's some of you. For those of you who have been members for 2 years, sit down. That's another big chunk. 3 years, sit down. A good doctor sat down too, so cool. 4 years, sit down. 5 years, sit down. So you don't see many people standing. But what I would suggest to all of those that sat down for the first 3 years, you go find every one of these folks because they are a great resource for you to talk to. They've been there, they've done that, and they have experiences to share. So let's keep going. 6 years, 7 years, sit down. 8 and 9, sit down. So Tony's back there, in the back. Tony Sauter, so he's been around. And I'm still standing, so that's 10. So let me tell you a little bit about myself. I'm a civil engineer, graduate from Michigan Tech a long time ago. I started in the Peace Corps. Came out of the Peace Corps, came back to the States, did the career, did the family thing. Got back involved in about 2003 with EWB. And at the same time, I was still working my day job at Tetra Tech. So here I am in Rwanda. I also worked in Kigali, Rwanda for on and off for about 5 years. And a project that I was working on there was to assist the government of Rwanda as its capital city grew from 800,000 people to 3.5 million people. And to look at all the engineering infrastructure that needed to happen to make that happen. And in Kigali at that point in time, there wasn't much. I saw one wastewater treatment plant that handled about 10,000 people. Most people had latrines or open defecation, even in the town, about 800,000 people. Kigali had one of the most expensive water sources in Africa, and it only served about 40% of the people 40% of the time in Kigali. So it was a tremendous project. It took a long time. But at the same time, EWB was working in Rwanda. And I actually went out a couple of times to see those EWB projects, to do, I think I collected pumice rock from one of them to bring it here to test it in the lab, and to do some on-site reconnaissance for our chapters. And this is one of the projects that I went to go see. So this is a project where one of our chapters had been working for a couple of years. And they had worked with that community to install 14 kilometers of water line. We built a couple catchment systems, and we built some tanks and some tap stands. But that wasn't what the community took me out to see. They took me out to see this. And this was the community's own constructed water catchment system. So they had worked with our chapters long enough to understand how to build them. And they had great masons. They knew exactly how to do masonry work. They learned how to capture a water source, how to put sand filtration behind the water source, how to connect it into the pipeline system. Most importantly, how to discharge the water that they collected into clean buckets so it wasn't contaminated over again. And they were extremely proud that they had been able to work with EWB and to duplicate something that they knew that would assist them in the future. And they had this system working. And I was there about 3 years after EWB built it. So the point of this story is, this is what we're going to focus on in the next 10 years. If I go back to your community 5, 10, 15 years after you've left, am I going to find that the community is proud, has added on to the system, has been able to maintain the system, has been able to expand it, or am I going to find a system that doesn't work, in which the community has been disappointed? So this is about the next 10 years of EWB. Part of what I'm going to talk about today is where we've been, how we've gotten to where we are, but most importantly, how we're going to move forward in the next 5 to 10 years, how we're going to make sure that we're living up to what we say we're doing. So my challenge to you throughout this conference is to see, is this picture in your project's future? If I go out 5 or 10 years, is your project going to be functioning like this one is? So our world today has many challenges. We saw some of them already this morning. We know the overall statistics that are out there, and they're daunting. It is very difficult to believe that we can make a difference. In Africa alone, 40 billion hours per year are spent hauling water, predominantly by women and children. 40 billion hours per year. And you see these statistics all the time. And you think to yourself, is this futile? Can we really make a difference? But I can tell you, in the first 10 years of EWB's existence, we have touched the lives of 2 million people. So collectively, all of you in this room, joining the remainder of our volunteers, have touched the lives of 2 million people. We don't know a lot about how you've touched the lives. Most of it's been in a very successful way, but some of it probably has not. So our goal in the next 10 years is to know exactly what we're doing and why. And when we run into those unintended consequences, to understand what they are and to learn to listen better next time so we don't have them. And here in the United States, we're falling further behind in STEM education and in the number of college students receiving engineering degrees. And we're the lucky in this room. So how many of you guys are engineers? Okay. How many of you guys are not? Excellent. I like to see that in the group because it takes many professions to have successful engineering projects, right? It takes all of us. And so if you're just engineers in your chapter, reach out to the other groups on campus because they know a lot about this. And they, with us working together, can really make a difference. And I will say that today, graduating from college, you all will be required to take anywhere between 15 and 25 less credits than I had to graduate. And a lot of those credits have come out in things like project management or communication or teamwork. They've been the electives that have been eliminated. And through EWB, you'll learn how to do those. And you'll learn that those skills are going to be what makes your project successful. Because if you don't know how to listen, and if you don't know how to translate what a community is telling you that they need into an engineering project, you'll probably do the wrong project. So I would inspire you and implore you to get education in order to do this work. We think technical education to be in EWB is a prerequisite, but you need to add on to that. You need to be looking at communication skills, at leadership skills, and those are some of the things that we're going to begin to offer you to assist you in your projects. So EWB has a twofold mission. Our first part of our mission is to do community-driven development projects in partnership with the community, in partnership with local NGO partners, to deliver sustainable and appropriate engineering projects. But at the same time, we understand that by doing that, we create transformative experiences for ourselves. And we're very intentional about that experience. We don't expect you to be comfortable all the time. You might be comfortable here, but as you try and figure out what your design is and what your material supplies are, you're going to be frustrated. You're going to be saying, well, if it could only be this way. If you go in country, you're going to be hot. You're going to be dehydrated. You might have diarrhea. Some of you have had malaria. You're going to be uncomfortable, and you're going to be frustrated. But it is the most rewarding work that I think you will ever do. And it's certainly been the most rewarding work that I've done. And how do we engineer this change? EWB-USA makes a 5-year commitment to the communities that we partner with. And today, we have about 370 of those community relationships. And within those community relationships or programs, with EWB's vernacular, we are doing about 600 engineering projects. So as you can imagine, if you're working in a community for 5 years, you may not just do one project. You might do a water project followed by a sanitation project, or an energy project followed by a latrine project. And that is how we do it. We create long-term relationships with these communities. We're not a one-in, one-out type of organization. We're going to install water here and then we're done. We work with the communities over a long period of time to figure out what they need. Not what we want to do, but what they need. And as I said, we have 615 projects around the world, predominantly in water and sanitation, but also energy structures such as bridges and clinics, roads, agricultural projects, and others. So one of the things that we talk a lot about is that EWB is not an international travel organization, and you heard the good doctor talk about that as well. And I actually found a YouTube video that kind of epitomized what the white volunteer is renowned for these days. And I want to say up front, I don't think this is you guys, although I do recognize a few little pieces in here as EWBers. But I want you to watch this. I've been told that some chapters actually want to use it in their chapter meetings.
You are a good person. You spend time with your family. You work out at the gym. You conserve water while showering. You like nice clothes. You give to charity. You recycle. You drive a Prius, but you use your bike when you can. You enjoy the occasional distraction at work, and you always send a card on Mother's Day. Always. But there's a part of you that tells yourself that you're not so good, that you could be doing more, that the world is falling apart at the seams, and all you've been doing is yoga. One day you see that the rainforest is being destroyed at a staggering rate of 32 million acres a year. That's the equivalent of one football field every 78 seconds. You feel bad, angry, guilty. You've been apathetic for too long. You want to do something about it. You must do something about it. Well, this is what you're not going to do.
Quit!
You're not going to quit your job, leave your family, get on the next flight to Nicaragua, take a bus to the edge of the jungle, then hoof it across rivers, lakes, and streams on a quest to the very heart of the rainforest.
Take me to the heart of the rainforest.
You're almost there. You have arrived.
You're not going to ingratiate yourself with the local tribesmen, go to great lengths to earn their respect and trust. It is around now you realize you're living out the cliché gringo fantasy of becoming an honorary native and leading the resistant forces. If they could do it, so can you.
I'm gonna save you! This guy comes over here and to do this, gonna pull zapping, that's going to
You're not going to coordinate and occupy the rainforest movement. Realize it's hopeless, summon the power of the gods, lead a revolution against the deforesters and their multinational employers in an apocalyptic once-and-for-all battle to save humanity, only to awaken 2 days later in an El Salvadorian hospital with 2 toes missing on your left foot. Hobble out of Central America, up through Mexico, across the Sierra Madre, where you break down, your first cigarette in 4 years, accidentally start a wildfire, killing off the endangered species that once served as your occupational distraction, finally make it back home, only to find you've been replaced at work by a guy named TJ, and that things at home are not what they used to be. You're not going to do any of these things, but what you can do is follow the frog.
So, recognize anything in there? The one that I think always resembles EWBers is the crouch down with the playbook, right? We're going to build this today and do that tomorrow on this, and then we have to reshape it. But that's not us, right? Right? It is not us. Come on. Okay. So, but that's what the Western volunteer is becoming known for. And we need to work and make sure that that's not our purpose in life. There are unintended consequences out there, and we'll always find them, but our original goal is not to go travel and have a great time. It's actually to do something. And it's to give back of our technical expertise in ways that make a difference to people who are less fortunate than we are. And you have to remember, we're quite privileged. We're sitting here on a Saturday at Rutgers University. We've had our first donut in maybe 24 hours or 2 weeks or whatever days. But we're very privileged. And not everybody was lucky enough to be born into what we were. And as engineers, it's our responsibility to give back. So we've spent a lot of time doing a lot of things in the past 10 years, and we put out annual reports each and every year. But last year alone, 99 of our chapters went into communities to try and make a difference in the lives of those people in those communities. And you can read about that in our annual report on the website. But you might ask, who are we that we do all this work? We all know that organizations have to have a board of directors, and then they have people like you who do the actual work. But what we don't know, and a lot of times in EWB is the latest, greatest hidden secret, is we have 300 to 400 people who are volunteers that help us do all this work. So we have the Council of Regional Presidents and the Regional Governance Committee. So for all of those who are in the Council of Regional Presidents or on the regional steering committees, can you stand up for a minute? Chris, I know you're in the audience, stand up too. So these are the guys who assist all of you in running this organization. I rely on these guys to help me figure out what matters to you all and what resources you might have or need. So go ahead and sit down. So the Faculty Leadership Council. Who's faculty in the room? There's a couple of you who are being shy. Great. So the faculty for student chapters, they're an incredible part of your chapter and an incredible resource for you on campus. Make sure you know who your faculty advisors are and make sure that they know what you're up to rather than signing a piece of paper and becoming part. So the faculty advisors are incredibly important. Anybody who's on the technical advisory committee and the health and safety committees and the standing content committees, stand up. So we have a few of these folks in the room. So they look at all of the projects before you guys implement. You guys can sit down. And their charge is to make sure that the projects as they're designed are safe for you and the community to work on, are culturally appropriate in those communities that you're working in, and are technically appropriate, so designed well. And it's not enough to do design as you may see design being done in Africa, but you must do design to the standards that we have here. Because people are people everywhere, right? They don't differentiate across the continent or across borders. But there's a lot of folks in that middle group who help us in the organization and management of EWB-USA. And we're always looking for new folks. So if you as a student or a professional have a passion about water and you think somebody else could benefit from the knowledge that you have on water, join one of the standing content committees. And let's start to get these best practices and lessons learned out amongst all the chapters so that we're not all making the same mistakes. And who we are at headquarters. So I get this a lot. We're 19 people at headquarters. There's 14,000 of you members. There's 19 of us. So we spend a lot of time with a lot of you, but we don't spend a lot of time with each and every one of you. But 19 of us, of which a third of us are professional engineers. Probably more than half of us have international development experience. And we're all as mission focused as you guys are. We consistently look into the field of international development to see what the best practices are and to raise our game as EWB in that field. We speak about 8 different languages, and we provide a lot of educational resources for you all. And then who are you? As I said, we have about 14,000 members. 70% of you are students, although I think there's more students in this group than 70%. And of our membership, 30% of us are female. Now the interesting thing is when you look at the student chapters, you guys are just about gender balanced. Okay? Which is phenomenal in the engineering profession, which has about 20% female. So gender balance means that we can listen without some of the gender filters in our communities. We have women talking to women's groups. I don't know if you remember back when maybe your chapter's an early chapter, but did some of the young men in your chapters have problems talking to those women's groups? I would dare say you did. And so it's great that we're gender balanced. And we're beginning to celebrate our leaders in this organization. One of the things that I think engineers don't do very well is celebrate the accomplishments that we've had. And we've had a lot of great accomplishments. We always want to do more. We tend to be aggressive overachievers, but we always want to do more. But we want to stop and celebrate the successes that we've had. And these 3 folks are a student, a faculty advisor, and a professional who have made a big contribution to EWB and their community. And so my challenge to you guys would be, will this be you on this slide next year? Nominations are open on the My EWB-USA webpage, but if you know of somebody in your chapter or in your region or in the organization that's doing a phenomenal job in their community, in their chapter, nominate them, because we would like to celebrate our successes in this organization. And then who are all of you? Well, you know what? You're the next leaders in the generation of engineers. Through EWB and through some of your other experiences, you stand light years ahead of those that don't have this type of experience. You're learning global perspective, you're learning management, you're learning how to manage teams and clients against a multicultural background. You're working outside of the engineering discipline. You're not only multidisciplined, you're transdisciplined. And some of our sponsors will tell you that to hire you guys is like hiring an engineer with 5 years of experience. But you all are in charge of keeping your chapters vibrant, of recruiting and engaging and retaining your members. Because without you, we wouldn't be making these impacts on communities. And as I said earlier, 14,000 of you touched 2 million people in the last 10 years. And that's pretty remarkable. And we have our partners, our corporate partners, from ASCE to Boeing to CBM Smith, all the way down to Penetron and Gannett Fund. And without our corporate partners, we wouldn't have the funding to exist. And so if you run into a corporate partner this weekend, tell them thank you. A lot of the project grant funds that come out. So who received a project grant in this latest grant cycle? There's a few of you. We were able to award 62 grants out of 125, and it's due to those corporate sponsors. So say thank you. As I said, we have about 389 programs in 47 different countries. And if you see the 389 and you're probably saying, well, she had 369 on the slide five slides ago. And that's because it changes. It increases every day. So when we pull our statistics, they tend to be different. So we have 389 programs in 47 different countries. And we've started to improve our reporting procedures. But I have to tell you, we still assume too much about what we've done in those communities. So if the upper picture is a photograph of a very successful project which constructed a piece of a road across a ravine between one part of a community and another to create access, year-round access between those two parts of the community. Very well-used project. But if you look at the project down below, that's a building, a CMU building. And the building itself was successful, but it sits vacant. And it sits vacant because it didn't have the support of the government structure to put teachers there. So, was that project a success? Or was it a failure because we didn't understand the government structure in funding the teachers in that project? So as I said, we are going to spend the next 10 years and beyond looking at what is actually happening with our projects. We started this effort in January of this year. We got together our donors, our board, and the staff, as well as sending a survey to all of you to find out what we wanted to know about the success of our projects. And it's important. This is a snapshot of some of our early Guatemala projects. And for those of you in back who can't really see all that well, the red means failure, and the green means success. So if you look at the first column, you see water pumps. And it's a sampling of, I think, 8 to 12 water pumps. But you see mainly red there. Anybody want to hazard a guess as to why those are red? You can't use the broad term maintenance, but other than that, anybody want to hazard a guess why those water pumps were failures? Okay. Those water pumps were failures because they came from the U.S. and the community couldn't fix them. So they failed. See the next two columns? The water with CR and the water without CR. So CR is a circuit rider. How many of you guys know what a circuit rider is? So there's a few of you. So a circuit rider program is a program that is in country where somebody goes from community to community to community to assist those communities in maintaining their water systems or maintaining their energy system. It's part of a utility setup, but they're there to help the community with things that the community might not experience every year or every 2 years, but they're an additional resource. And so those projects in Guatemala found that if you had a circuit rider, you were almost guaranteed success on your water projects because that community had some outside assistance. But if you didn't, those projects were failures. Because eventually what happens with the water system is somebody will get mad because their neighbor's taking too much water, then they'll take their valve off and let the water free-flow, and all of a sudden the system goes into disarray. And it will fail. And it won't fail a year after you're there. It'll fail 4 or 5 or 6 years after you're there. So for those of you who are working on a water project and didn't know what a circuit rider was, I think you should be asking your project manager or your mentor, is there a circuit rider in the community in which we're working? And figure out how to do that. Not to say it can't be done, but the odds are against you being successful if that community doesn't have some outside assistance. So I'm not going to go over the rest. You'll find this report on the news section of the EWB-USA website, where we're going to start putting reports like this so that we get the best knowledge out there that we can to help you guys in doing your projects. But this was the first one that we did. A volunteer did it in 2011, I believe, and has since gone back and fixed a lot of these failures. But as part of this, we took a look at what we could change as EWB and what we couldn't change. And I don't expect you to read all this, and Tiffany will go over it later as well, but there are things that we need to understand that will never change in these communities, and the things in gray, like state, economic, and the social environment. We don't work on that level, and we have to trust that other NGOs and the government itself is working on that level. But there are things that we can change, and that's making sure we do the right project, that we listen to the communities, that we use the right materials that can be maintained or sourced locally, and that they are sustainable projects. So we're going to spend a lot of time focusing on that in the next few years to make sure that we understand what we're doing and do it very deliberately and very intentionally. And this includes monitoring and evaluation. So you'll hear about a PMEL program. And PMEL stands for planning, not project, but planning. So something you do in your assessment. Monitoring and evaluation, something that you do all the way along and as you end your project. And then learning, which is something that we as an organization will do after the projects are completed. And we truly are focused on assessing the impact that we have in these communities, both short, medium, and long term. So you hear a little bit about this from Tiffany later today. And then for the next, as I said, few years, we're going to implement this system. And we're going to move forward as an organization. And we're going to know what impact we're having in our communities instead of guessing at it or hearing about it from anecdotes or finding pictures posted on YouTubes or blogs. And then what are we going to do to improve ourselves? So we're going to get all this great information that comes off our projects. We're going to learn what we need to learn. We're going to learn things that don't work, so we're going to quit doing them. We're going to learn things that do work, so we're going to incentivize them. But how are we going to get that word out to you? So at HQ, we're going to start focusing on group education, so new chapter orientation. So chapters, as you switch over officers, especially student chapters, because sooner or later, 100% of you in your chapter will graduate, hopefully. So for student chapters, we're going to start having new officer orientations, so that as you bring officers in, that we can share with you what works with other chapters that have figured out these transitions. We're going to have new program kickoff calls. So how many of you guys are getting a new program this year? That you know of? A few. Find out when this new program kickoff call is, because it will save you significant amounts of time as you get that program off and running. And then technical webinars. So we're going to start doing these technical webinars and show you exactly what we're looking for you to do as you progress through your project process. And we've got them on assessment trips for water supply. We've got them on structure assessments, the project process, preparing for your latrine assessment, and planning for sustainability on assessment. We're also going to do them on the planning, monitoring, evaluation, and learning process so that you understand exactly what we're looking for as you submit your requests to travel and approvals of your implementation projects. And we're not just doing this so that you guys can come listen to us for an hour. We're actually doing this to save you time. And so I think some of the chapters, have some of you guys in this room taken these? There's probably a few of those. Hopefully they've saved you time and shown you what we're looking for, because that's the goal. If they don't, let us know. But we're actually doing this to make your job easier. And then micro courses. You'll start seeing EWB providing micro courses on certain things, like we have the photovoltaic one out there, where going to put a lot of information dealing with that specific subject in a microcourse in one place where you can find it all. And those will start coming online in the next year. We're also going to continue to do conferences. We have teamed up with ASCE and we'll be in Panama in October of 2014. And that Panama course is, since it's so far from here, going to be a little bit more expensive for you guys to get to, but it'll be a 3-credit engineering course. So it will transfer into your university as part of your education. We're working on the curricula now. The credits themselves will be issued by CU Boulder. And we're working on sponsorship and scholarship opportunities for you all to come to Panama with us. Now, in Panama, we have only 300 to 400 slots available, which is roughly this size. So we think we're going to sell out. And so we're also going to be doing 2 multi-region conferences next fall, probably the first 2 weeks in November. And we're looking at those multi-region conferences, not just being regional conferences, but being topic-based. So one will most likely be WASH, water and sanitation and hygiene, and the other one will most likely be monitoring and evaluation. So you'll have 3 educational opportunities next fall where you can get together with your EWB buds and share what's worked, what hasn't worked, who's working in what country, and what tips and tools can you pass along. And then the other thing that we're looking at is we're starting to gather best practices. So Fritz Fielder, who's a faculty advisor at the University of Idaho, would love to hear from you all about what training tools you're leaving in the community. So if you're leaving visual aids on how to maintain a latrine or how to maintain a water system, let us know so we can start sharing that with all of you. Fritz did send out an email. There was an email link in the latest My EWB or the eBlast. So go look for that. But we're actually looking for those materials to share. And then I can tell you Chris Lombardo, so Chris, stand up a minute. He is looking for a sample contract that we've signed with a drilling company. So if you drilled a well in your community and you signed a contract, give it to Chris, because he needs one for one of his projects. And then we're going into the year-end campaign. So how many of you guys participated in last year's fundraising campaign at the end of the year? I saw one hand go up, right up immediately. So if you haven't seen it already, we're starting to get you guys prepared for that. We've sent out materials through the eBlast and to the chapter presidents. We again have $100,000 in match money and 2 $5,000 prizes. But this is a great time to raise the majority of the money for your projects for next year. So know about that campaign. Our goal is to raise $500,000 together, and it should be easily doable because last year we raised $670,000 together. And that funded a lot of your projects. So if you don't know about it, go for it. And yes, I know the match runs out fairly quickly, but that's not the point. The point is that we should all be fundraising this type of year for our projects. And we can do it together. And then be a part of EWB-USA. You guys are already a part because you're sitting here today. But on your campuses, get your colleagues to join your club, to hear about what you're doing, talk about what you're doing. Talk about how you're just not going to have a great international travel experience, but that you're actually making a difference in somebody's life. There's a lot of the rest of the world out there. We're part of the privileged 10%, but the world isn't flat, and the world isn't equitable. And it's up to us to make sure it becomes a little more equitable as best as we can make it. And as the good doctor said earlier, we can transcend political boundaries. We can transcend other boundaries. Water flows downhill, and it really doesn't care whose ground it flows across or whose border it flows across. But we can provide a lot of the solutions through a good technical engineering solution, and we can actually do a lot of good beyond just clean water. We can get communities working together, talking to each other, and we can start to affect a lot of change. And you guys are all at the forefront of that. So, as I said earlier, I am lucky enough to be part of this organization. And we're going to see it move in the next 5 years, in the next 10 years, to an organization that makes a difference, that knows exactly how it's making a difference, and that is an inspiration to the other organizations that are trying to do what we are. So all of you guys are a part of this. This is my 6th conference this fall. And I have to say, I think we saved the best for last. I am celebrating A, because I'm done, but B, because you guys are the largest conference. And it's really, I go on the road this time of year because I need to see you. I need to connect back in with all the work that you're doing, because I will go into the next year of administrivia, of fundraising, and I'm connected with you as I do that. And I think it's really important to get in touch with others who understand the work that you're doing, who understand how hard you're working to make a difference, because you truly are making a difference. And that's not going unnoticed. It doesn't go unnoticed by me. It doesn't go unnoticed by the sponsors that are here. So I'd encourage you this weekend, learn from everybody else. I know a lot of you, I watched a lot of you come in this room and you sat together in your chapters. I challenge you to break outside of that chapter format. In each session that you go to, sit next to somebody you do not know, because that person next to you may have something that may fundamentally change what you're doing in your community, or you may give them a tip that will fundamentally change what they're doing. So break outside your comfort zone. In a couple of the other conferences, I've kind of dared you guys to put your feet or your shoes on your opposite feet and be a little uncomfortable about that. You can if you want. There's a lot of you in the room. But step outside your comfort zone. Do it this weekend, because I can guarantee you will do it in your communities if you don't do it there. So thank you. I think we're just about done, and I'm going to hand it back to Cassie.
I'm going to ask Rosemary Howard to come up to the stage too. So now it's my pleasure to announce Regional Premier Chapter Awards. So these awards are given to the chapters who display excellence in organization, in fundraising and public relations, excellence in their faculty advising and mentoring relationships, and also in their chapter and regional participation. So we had a few chapters that were nominated this year that were all excellent, and we had to make the decision to limit it to just 2, one professional and one student chapter. And I'd like to announce those right now. The 2013 EWB-USA Regional Premier Chapter in the professional category is the New York City Professional Chapter. Do we have representatives from the New York City chapter? Over here. All right, come on up. Anybody else?
Tim's a long-time member. Yeah. All right, Jessica. And the 2013 EWB-USA Regional Premier Chapter student group is Northeastern University.
had really great attendance at the regional conference. For your hard work throughout the year. It's been amazing to get to know your chapters, pretty much all of you. It's exciting what's going on here in the region. So, just a few notes too. Lunch today is going to be held with your state rep. So those rooms are divided out. You can see that in your session. And that's just to encourage you to interact with your state reps and the other chapters in your state. So if you want lunch, that's where you gotta go. All the breakout sessions are in Grunhausen, Houston? I might pronounce that right. But there's another building, and there'll be volunteers to help guide you out there for those breakout sessions. And for next up in the schedule, so you can see we have group photo and snack break. It's gonna get a little complicated. We're gonna try to do it very efficiently. So the plan is to have the group photo outside and across the street on some steps out there. And we're going to have you all go out and do that immediately. And then after that photo is taken, you can come back in here and have snacks in this room before going into your breakout sessions. So we're going to ask you to move very quickly out there. We're going to do a full group session, a photo, and then we'll probably have a second photo with the Regional Premier Chapter Awards, followed by the Rutgers student volunteers, and then the regional committee members. So let's go out and do that.
It's recording. It's recording.
Oh, it's recording. Yeah. Oh, then I will try it.
A little bit. You got that.
Follow me on Twitter. Looking at the plans. We're digging. That's really good. It has some.
I'm only realizing now that there's a
Did
lot
you
of...
know you